Lactose intolerance is a common digestive issue that affects millions of people worldwide. If you suspect you might be lactose intolerant, it's important to have an open and informed conversation with your doctor. In this video, we'll explore the essential questions you should ask your healthcare provider to better understand your symptoms, diagnosis, and management options. By preparing the right questions, you can make the most of your appointment and ensure you get the guidance you need for your health and lifestyle. When you first visit your doctor about possible lactose intolerance, it's crucial to discuss your symptoms in detail. Ask your doctor which symptoms are most commonly associated with lactose intolerance and how they differ from other digestive issues. This conversation can help you and your doctor determine whether your symptoms are likely due to lactose intolerance or another condition. Be sure to mention when your symptoms occur, their severity, and any patterns you've noticed. This information will help your doctor make a more accurate assessment. It's important to understand that symptoms similar to lactose intolerance can be caused by other conditions. Ask your doctor what other medical issues could be responsible for your digestive discomfort. This will help rule out other possibilities such as irritable bowel syndrome, food allergies, or infections. Understanding the range of potential causes ensures you get the right diagnosis and treatment plan tailored to your needs. Diagnosis is a key step in managing lactose intolerance. Ask your doctor about the different methods used to diagnose this condition. Common tests include the hydrogen breath test, lactose tolerance test, and elimination diets. Understanding the pros and cons of each diagnostic method will help you prepare for the process and know what to expect. Your doctor can explain which test is most suitable for your situation and how to interpret the results. Before undergoing any diagnostic tests, it's helpful to know what the process involves. Ask your doctor what you should expect during the testing phase. Find out if you need to fast, avoid certain foods, or prepare in any special way. Understanding the testing process can help reduce anxiety and ensure you follow all necessary instructions for accurate results. Once your tests are complete, it's important to understand what the results mean for your health. Ask your doctor to explain your test results in detail. Find out whether the results confirm lactose intolerance or suggest another issue. This is also a good time to ask about the reliability of the tests and whether further testing is needed. Lactose intolerance can vary in severity from person to person. Ask your doctor how severe your lactose intolerance is and what factors might influence it. Understanding the degree of intolerance can help you make informed decisions about your diet and lifestyle. Your doctor can also explain whether your intolerance is likely to change over time or remain stable. One of the most common questions is how to adjust your diet if you have lactose intolerance. Ask your doctor which foods you should avoid and which alternatives are available. Your doctor can provide guidance on reading food labels, finding lactose-free products, and ensuring you still get essential nutrients like calcium and vitamin D. Managing symptoms is a key part of living with lactose intolerance. Ask your doctor what strategies you can use to minimize discomfort. This might include using lactase supplements, eating smaller portions of dairy, or choosing lactose-free products. Your doctor can also recommend ways to track your symptoms and identify triggers. Lactase supplements can help some people digest lactose more easily. Ask your doctor if these supplements are right for you, how to use them, and whether there are any side effects. Your doctor can also explain how effective these supplements are and whether they're suitable for regular use. People with lactose intolerance may have trouble getting enough calcium and vitamin D, which are important for bone health. Ask your doctor how you can maintain adequate levels of these nutrients. Your doctor may recommend dietary changes, supplements, or specific foods that are rich in calcium and vitamin D, but free of lactose. Understanding how to read food labels is essential for managing lactose intolerance. Ask your doctor or a dietitian what ingredients to look for and which terms indicate the presence of lactose. This knowledge will help you make safer choices when shopping for groceries or eating out. Lactose can be found in unexpected foods and medications. Ask your doctor about hidden sources of lactose and how to avoid them. This is especially important if you have a high sensitivity. Your doctor can provide a list of common foods and products that may contain lactose, helping you stay vigilant. Eating out can be challenging for those with lactose intolerance. Ask your doctor or a dietitian for tips on dining out safely. Find out how to communicate your dietary needs to restaurant staff and what questions to ask about menu items. This will help you enjoy meals out without worrying about accidental lactose consumption. Traveling can present unique challenges for people with lactose intolerance. Ask your doctor how to manage your condition while on the go. This might include tips for packing safe snacks, finding lactose-free options abroad, and handling emergencies if you accidentally consume lactose. It's important to understand any long-term health risks associated with lactose intolerance. Ask your doctor if there are any complications you should be aware of, such as nutrient deficiencies or bone health issues. Your doctor can also explain how to monitor your health over time and when to seek further medical advice. Sometimes, managing lactose intolerance may require the help of a specialist, such as a gastroenterologist or dietitian. Ask your doctor when it's appropriate to seek specialist care. This can be especially important if your symptoms are severe, persistent, or not improving with standard management. Lactose intolerance can sometimes run in families. Ask your doctor about the role of genetics and whether your family history increases your risk. This information can help you understand your own condition and inform other family members who may be at risk. If you have children, you may wonder if they are at risk for lactose intolerance. Ask your doctor about the signs of lactose intolerance in children and how to manage their diet if they are affected. Your doctor can also advise on the best sources of nutrition for growing kids who need to avoid lactose. Pregnancy can affect your digestive system in many ways. Ask your doctor if lactose intolerance can change during pregnancy and how to maintain a healthy diet for both you and your baby. Your doctor can provide recommendations for safe sources of calcium and other nutrients during this important time. Lactose intolerance and milk allergy are two different conditions. Ask your doctor how to distinguish between them and what symptoms are unique to each. This will help you avoid unnecessary dietary restrictions and ensure you're managing the right condition. Some people experience temporary lactose intolerance due to illness or injury, while others have a lifelong condition. Ask your doctor whether your lactose intolerance is likely to be temporary or permanent and what factors might influence this. This information can help you plan for the future and adjust your lifestyle accordingly. Regular monitoring is important for managing lactose intolerance. Ask your doctor how often you should check in about your symptoms and whether any follow-up tests are needed. Your doctor can also recommend ways to track your dietary habits and symptom patterns over time. Lactose intolerance can affect your daily routine, from meal planning to social events. Ask your doctor how to manage these challenges and maintain a positive outlook. Your doctor may have practical tips for handling awkward situations and making your lifestyle adjustments easier. Living with a dietary restriction can be emotionally challenging. Ask your doctor about resources for emotional support, such as counseling or support groups. Addressing your emotional well-being is just as important as managing your physical symptoms. There are many dairy alternatives available today. Ask your doctor or dietitian about the best lactose-free or plant-based options for you. Find out which products provide similar nutrition and taste, and how to incorporate them into your meals. Some research suggests that probiotics may help with lactose digestion. Ask your doctor if probiotics could benefit you and which strains are most effective. Your doctor can also explain how to include probiotics in your diet safely. Some medications may contain lactose as a filler or interact with your digestive system. Ask your doctor if any of your current medications could affect your lactose intolerance or if you need to avoid certain drugs. Your doctor can review your prescriptions and suggest alternatives if necessary. Lactose intolerance can sometimes occur alongside other food intolerances. Ask your doctor if you should be tested for additional sensitivities, such as gluten or fructose intolerance. Identifying all your triggers can help you manage your diet more effectively. Cultural traditions and social gatherings often involve food. Ask your doctor or dietitian for advice on navigating these situations while managing lactose intolerance. They can provide tips for participating in cultural events and maintaining your social life without compromising your health. Managing lactose intolerance at work or school can be tricky. Ask your doctor for strategies to handle meals, snacks, and social events in these environments. Your doctor can also suggest ways to communicate your needs to colleagues, teachers, or cafeteria staff. Lactose-free and specialty foods can be more expensive. Ask your doctor or dietitian for budget-friendly ways to manage lactose intolerance. They may suggest affordable alternatives, shopping tips, or recipes that fit your dietary needs without breaking the bank. Cooking at home is one of the best ways to control your diet. Ask your doctor or a dietitian for lactose-free recipes and cooking tips. They can recommend ingredient substitutions and methods to make your favorite dishes safe and delicious. Physical activity is important for maintaining bone health, especially if you're at risk for calcium deficiency. Ask your doctor about the best types of exercise for supporting your bones and overall health. They can also explain how to balance physical activity with your dietary needs. Keeping track of your progress can help you manage lactose intolerance more effectively. Ask your doctor for tools or apps that can help you monitor your symptoms, diet, and overall health. Regular tracking can also make it easier to spot patterns and share information with your healthcare team. Accidentally consuming lactose can sometimes cause severe symptoms. Ask your doctor what to do in case of an emergency, such as severe abdominal pain or dehydration. Your doctor can provide an action plan and let you know when to seek immediate medical attention. There are many resources available for people with lactose intolerance. Ask your doctor about reputable websites, books, and support groups. These resources can provide additional information, recipes, and community support to help you manage your condition. Medical research on lactose intolerance is ongoing. Ask your doctor about the latest findings and any new treatments that may be available. Staying informed about advances in care can help you benefit from the most up-to-date recommendations. Managing lactose intolerance may involve medical visits, tests, and special foods. Ask your doctor or insurance provider about what is covered under your health plan. Understanding your coverage can help you plan for any out-of-pocket expenses and access the care you need. If your lactose intolerance affects your ability to work, you may be entitled to certain accommodations. Ask your doctor about workplace rights and how to request adjustments, such as access to lactose-free foods or flexible meal breaks. Your doctor can also provide documentation if needed. If your child has lactose intolerance, ask your doctor about school accommodations. This might include special meal plans, access to lactose-free milk, or permission to bring snacks from home. Your doctor can help you work with school staff to ensure your child's needs are met. Clear communication is key to managing lactose intolerance. Ask your doctor for advice on how to explain your condition to friends, family, and coworkers. This can help prevent misunderstandings and ensure you get the support you need in various settings. Your needs and challenges may change as you adapt to living with lactose intolerance. Ask your doctor how to reassess your management plan over time and what signs indicate you should make adjustments. Regular check-ins can help you stay on top of your health. Setting clear health goals can help you stay motivated and proactive. Ask your doctor for help in setting realistic goals for managing lactose intolerance, such as improving nutrition, reducing symptoms, or increasing physical activity. Tracking your progress can make these goals more achievable. In summary, asking the right questions can empower you to manage lactose intolerance effectively. From understanding your diagnosis to making daily adjustments, your doctor is a valuable resource. Remember to keep an open dialogue, stay informed, and take proactive steps to maintain your health and well-being. With the right support and information, you can live well with lactose intolerance.